in a minute. Doctor?
Thank you very much, Daniela. Good afternoon, good morning, dear participants. My name is Frederick Nyang. I'm the director of the African School of Regulation. And it is my pleasure to welcome you to this webinar today, this conference today. This is one of the things that we do at the ASR. Stakeholder engagement is very dear to us, and we like to engage with our stakeholders to discuss topical issues. And today we are discussing one of those hot issues, hot topics. And we have a very distinguished panel that is going to take us through, led by Charlie from the SE for All and other distinguished participants. I would also like to make a presentation at the beginning to get the ball rolling, and then we'll open it up to the discussion. So Daniela, with your permission, would you like me to make the presentation now?
We'll let Rahul give us short words of introduction, and then you can give us, I'll let you know when to present. Rahul.
Okay, thank you very much. Back to you, Daniela.
Good morning, everyone from Washington, D.C., and good afternoon, good evening too, to those joining from other parts of the world. I'm Rahul Srinivasan. I'm a Senior Energy Specialist at Sustainable Energy for All. And on behalf of Sustainable Energy for All, it's a pleasure to invite all of you for this virtual conference. We're very happy to partner with the African School of Regulation to discuss this very important topic, electrification of public institutions, especially health facilities. SE for All has been at the forefront of working on this topic, on this important topic, electrification of health facilities, since the past 10 years. Of course, this topic has gained a lot of traction since COVID-19. We have worked with various partners, various stakeholders across the spectrum, from donors and multilateral organizations to the private sector. And we think that the sector has come a long way. It really has come a long way. And today is a good opportunity to reflect on where we stand and what needs to be done to really reduce the gap that currently exists. We know that many people still lack access to electricity, especially in sub-Saharan Africa. And we also know that approximately $5 billion is needed to close this gap on a global basis. And most of that funding needs to be mobilized in sub-Saharan Africa. So over the next 3 days, we're looking forward to an exciting discussion on what are some of the challenges that need to be addressed and what are the recommendations being proposed by the experts that will join this discussion over the next 3 days. So Daniela, I'll hand it back to you, and we declare this virtual conference open.
Thank you very much, Rahul. Thank you, Doctor. Before we start with some presentations, I'd like to hear from the audience. So I'll share a link via the chat so that we can hear from you. We'd like to know where you're from. So please take some time, and I'll share the screen to see where our participants are joining us from. We have some people from Nairobi, Austria, New Delhi. Nice to see. Nice. We have people from Zurich. That's exciting. We have people from Austria. Greater representation from Austria. Where else are we from? We have a couple of people on the call, so please take some time to answer the question on the chat. Austria is Zurich is representing. Madagascar. Okay, I can see people typing in the chat instead. That's nice too. Okay. So I see Sierra Leone, Uganda, Zambia, Mombasa, New York, Madagascar, Abuja. We have some people from India, somebody from Hyderabad. I hope I'm pronouncing that well. We have people from Zimbabwe, Guinea, Eswatini. Hello, Eswatini. Lagos, Barcelona, Ethiopia. We're happy to have you. I have more people from Nairobi, people from Ghana, people from Kenya, Brussels as well, Somalia. Welcome, Somalia, Malawi, Italy. We're very happy to have you here. Yes, and we have people from Combate, Ghana. Oh, Combate is from Ghana, sorry. Ghana, yes. Nice, nice, nice. France, people from France, Cameroon. We're very, very happy to have you here. I'll share another question via the chat. We have a second question, so please take some time to answer this one as well. I'll share it via the chat. So please click the second link that I just shared via the chat. Take some time to answer that, and I'll share my screen. Second question, yes, is how you would describe your familiarity with the topic of healthcare electrification. I have a couple of answers. We have people that consider themselves quite familiar with the topic of today. So no beginner in the session. Most people are intermediate and advanced. That's good to see. All right. Second link is on the chat. Let me share that again. Esther. Here's the link, Esther. So most people are quite familiar with the topic of the day. That's good to see. And we have another question for you. Don't get tired. It's the last one, I promise. So the third question, I'll share it via the chat as well. Yeah, most people are experts. Not most people. Most people are intermediate, and we have some people that are advanced, that have an advanced understanding of the topic. 12%, 10s, 13% are experts. Okay. I'll stop sharing this, and then I'll let you answer the third and final question. Which is here. I'll let you answer that. Results. Which of the following aspects of healthcare electrification interest you the most? Most people are interested with financing so far, coordination, data regulation. All right, no more answer. If not, we'll just go ahead with the presentations then. Thank you so much for indulging me. We're very happy to see a great representation from people all over the world. I'll let Dr. Frederick present a bit about regulation in the healthcare sector, in healthcare electrification, and then Rahul will follow. Thank you very much.
Thank you very much, Daniela, for the introduction. So let me share my screen. Okay. So, ladies and gentlemen, I'm very happy to be with you here today in this conference. I have a few slides which I'd like to share with you on the regulatory perspectives, on the need for sustainable and scalable business models. And we are looking at this in relation to how it applies to the electrification of health centers. So this is the outline that I'm going to use. And we're going to start from here. Essentially, we are looking at, sorry, I am ahead of myself. Okay, so regarding the sustainability business models for electrification of health centers, we essentially are looking at the sustainability of business models and what is required for this. And we consider that the business models are sustainable if the supply of electricity can remain operational indefinitely. Indefinitely. That's an important consideration. And they're also sustainable from the government's perspective and also from the perspectives of the suppliers. And the suppliers here could be the public sector, could also be the private sector. But it's important that in either case, whether it's by government or by the private sector, that they're sustainable and scalable. So regarding scalability, we consider that the business models are scalable, and here we are referring to mini-grids and standalone systems mainly. We consider that they are scalable if it can attract the right financing needed to install and operate the electricity supply system to meet all the electrification needs. So here, if we're looking at a country, in most cases, we're looking at countries, we are considering a situation where all the health centers must be electrified, not just one, not just in some regions, but all of them. So what are the requirements for a viable business model for electrification of health centers? Essentially, that should be, they must be consistent with the public service mission of financing the health centers themselves. And we note that electricity, of course, is a cost component for health centers. But electrification, of course, is not their core business. So the health centers electrification business model must be sustainable, financially viable permanently, and they must also be scalable, where all the health centers must be electrified. So situations that are non-sustainable and non-scalable. Here we turn to this publication by Sustainable Energy for All. And we recognize the fact that in most cases, the electrification of health centers relies on the EPC model. And the EPC model generally overlooks long-term operations and maintenance requirements. And this is what makes them non-sustainable. That raises concerns for sustainability. So what are the issues with the present business models? Electrification of health centers is generally done through a silos approach, where the electrification of the health centers is considered separately from the overall electrification effort in each country. So you find that in many instances, the health centers are being electrified in isolation from the overall electrification efforts of the country. We also find that many existing health centers are built with concessional money. So usually you will have the initial capital that is available for setting up the centers, setting up the electrification systems. But after that, the additional funding that is required to ensure that the system remains viable is not available. And that is a concern for sustainability because that compromises the sustainability part. The capital expenditures and the operational expenditures required generally not being available is a key concern for sustainability. So in searching for a solution, again, referring to this report by Sustainable Energy for All, the solution that is generally being accepted is that there should be a shift towards the energy as a service model, e.g. setting up the energy service companies. And essentially this involves the private sector, where private sector providers would offer electricity services over extended periods. And also they will ensure that the quality of the power that is supplied is consistent. And this works well because the energy service provider essentially is set up to provide energy. The health centers themselves are basically set up to provide health services and generally do not know how to provide the energy for themselves. So having an energy as a service model actually works very well because the private sector brings in their private sector, the expertise from the private sector. They concentrate on providing the electricity services because this is what they're set up to do. So how do we then find a solution to ensure that the electrification of health centers is done in a way that is sustainable and scalable? The elements of the solution include this, that electrification of health centers requires dedicated entities. And here we're looking at specialized public service agencies or the private sector. And if you're looking at the private sector working in collaboration with the public sector, we're essentially looking at the public-private partnerships model. And this has the advantage of reducing costs because they make use of the economies of scale. They can also supply multiple customers. So it's not just the health center. They're not specifically set up for the health center, but they also supply other models, other customers, therefore enabling them to exploit economies of scale. And it's also possible for these specialized public agencies or concessionaires to reduce costs because they would then have the advantage of using advanced technology to be able to supply electricity to the health centers. The other element of the solution has to do with the remuneration of the electricity supplier. And this has to be attractive and low risk because the public-private partnerships will not participate in this unless they are assured that the risks are low and unless they are assured that the remuneration that they will be getting will give them a good return because they're essentially set up as a profit-making entity. And unless the profits are assured, it's unlikely that they would be interested. So to get the the private sector participation in the electrification of health services, the remuneration issue is an important aspect for sustainability. And how to make this possible? Again, we turn to this report, which has covered this topic very well. And here the suggestion is that governments should include the electrification of health centers in the national electrification strategy, and they must also have policies that prioritize the electrification of health centers. And if you look at Sub-Saharan Africa, this is something that quite a number of governments have done. If you look at the national electrification strategies, many of them do have policies that prioritize the electrification of health centers. In some cases, this is done through mini-grids or off-grid standalone systems. And in some cases, this is also done by extending the grid. But at the end of it, what is important is that the aspects of sustainability must be taken into account. And what are the requirements for a satisfactory business model for electrification of health centers? We have two issues that we want to raise here. And the first one is that the business model for the electrification of health centers must be scalable. And here we are looking into electrifying all the health centers. And for this to happen, it's important, therefore, that it must be integrated into the larger picture of the National Electrification Plan, which means that this must be, there must be elements of this included in the National Electrification Strategy for the countries. And the strategy must prioritize the electrification of health centers because health centers provide an essential service, and especially in the rural areas where most of these are found, where the residents have no alternative except that. The second aspect is that the business model for electrification of the health centers must be sustainable. And as we have mentioned before, we are looking at financial viability, financial sustainability that is permanent and continuous. So governments must adopt financing of electrification of health centers in an integrated way. And this requires that they consider all electrification modes, including all the contributions and all the parties and stakeholders who contribute to electrification of health centers, including the development finance institutions, donors, the private sector, and of course the income from the regulated tariffs as well, which means that the regulators and the ministries of energy have to be involved in this aspect to ensure that the business model is sustainable. The very specific requirements that we would also consider include focusing specifically on remuneration of the electricity suppliers. It is essential to ensure that this is based on a concessional contract that would be based on the outcome of a tender or regulated, or it must be based on an efficient cost of service with a reasonable rate of return. And the reasonable rate of return, if you look at many regulations in many of especially sub-Saharan African countries, you will find that the reasonable rate of return is actually embedded in many of their regulations. But whether or not this is practiced is another matter. The second aspect of this is that it must be based on a subsidized tariff for the health centers, which should be covered by the government, plus direct subsidies to the suppliers, which could be obtained through cross subsidies within the integrated financial electrification plan. Now, these are aspects that it is possible for the governments to consider. And if you look at the regulations in many of the African countries, this is something that is already happening. And one of the things that is important and which is consistent with the proposals that we are making here is the fact that in many of the African countries, electrification goes along with a lot of subsidies from the government. And therefore, even in cases where the electrification of the health centers themselves are being electrified by the private sector, it is important for the government to be involved so that the aspect of subsidizing the supply of electricity in these health centers can also be taken on board. And with regard to this, the African School of Regulation recently held a policy dialogue in Kampala in September. And this is a copy of the report that came out of that, talking about sustainable and scalable mini-grid business models. This is on our website, and it is available to all our stakeholders. I would request that you take a look at it, because this is the framework that we have used for making this presentation. And with that, I would like to end my presentation here and to take it back to the moderator. Thank you very much. Back to you, Daniela.
Thank you very much, Doctor. I'd like to call upon Nicholas to give us a presentation from the Sustainable Energy for All team.
Thank you very much, Daniela, for the introduction, and also thank you to my previous speakers for setting the scene, which I hope resonates well with my presentation. So welcome everybody as well from my side, and I'm pleased to present you SE4All's work on the Sustainable Energy Policy Hub, especially with regards to powering healthcare infrastructure. My name is Niklas Hayek. I work as a consultant for SE4All, and together with a few colleagues, I've been responsible for developing this virtual tool, which can hopefully support your work, irrespective whether you work at government entities, within the private sector, at development partners, or at healthcare institutions themselves. I'd like to start with two statements from the World Health Organization, as well as the report that my previous speaker has also referred to a few times. on the status quo healthcare electrification. So first, as many of us are probably aware, more than 1 billion people globally are served by healthcare facilities with no electricity access or with unreliable electricity, which was the status last year and unfortunately hasn't improved significantly ever since. At the same time, the Global Status Report has found that only the existence of an enabling policy and regulatory framework enables the private sector to become active, to invest and engage in healthcare electrification. So now the question is, of course, how can policy and regulatory frameworks be developed in a way that these conditions are ensured? And that same status report has identified a few gaps and also opportunities for the policy and regulatory frameworks to reflect these needs. So first, of course, capacities and resources for healthcare electrification need to be ensured. There's often a lack of institutional coordination between within the public sector, but of course also related to non-governmental institutions. It's crucial to understand the health sector's energy-related needs and avoid silo thinking. It's like not considering the electricity or power sector separately from the health sector, but as also mentioned in the previous presentation, see them as an integrated challenge to be addressed by policy and regulation. And last but not least, financing options have to be flexible enough to cater for the different needs of different regions, of different types and locations of facilities. Now, if we look at a typical policy and program cycle in order to improve SDG 7, Sustainable Development Goal number 7 on affordable and clean energy for all. Usually, this policy or program cycle starts with identification of a problem, the formulation of a policy or the conceptualization of a program, the decision-making process in order to start the implementation of the policy or program, and ideally an evaluation activity in order to improve and adapt the policy or program. Now, there's lots of experience already related to health electrification across the globe. And when it comes to policy and regulatory framework development, the question that we should ask ourselves is, do we need to reinvent this wheel if there are some similarities, while of course every policy or program has to be adapted to the nation's, regions, or local needs. So against this background, we've teamed up with a variety of experts across the globe from different organizations, government entities, development partners, knowledge partners, academic institutions, in order to develop the Sustainable Energy Policy Hub, which features various areas of sustainable energy since a few months, excuse me, also including powering healthcare. Now, what you see here is the decision tree on powering healthcare, which is the backbone of this online tool that I'm going to showcase in a few minutes. Now, it's probably a bit hard to read, and you don't need to read through all of this. I just want to point out that basically the user of this online tool clicks through a set of questions describing the situation of the country that he or she is investigating or wants to improve on. And user will land at different areas, which include data collection analysis, policy and planning and institutional framework, technical aspects for healthcare electrification with regards to policy and regulations, and financial aspects. The first question is indeed what Dr. Frederick said in his statement, that one of the most important aspects of a suitable policy and regulatory framework is whether healthcare is addressed in the National Electrification Plan or strategy, and depending on the answer, the user will land with a respective recommendation. And this is what it looks in practice. So the user, and you will have the chance to take your own look at it and play around with it, is on the left-hand side, see the question of that particular step of the decision tree. So here, an example that the impact and the nexus between energy, health, and other dimensions, including gender, climate change, or jobs, as an example, needs to be understood. And on the right-hand side, the user will find online resources that are available to everyone free of charge that can inform this particular step. So in summary, the Energy Policy Hub, the Sustainable Energy Policy Hub, is a platform that can help supporting conducive policy and regulatory frameworks for sustainable energy, including powering healthcare. And it can support your work depending on the area where you work and type of institution that you work for, to better improve or to better structure planning, consultation, and policy making for powering healthcare. It promotes an integrated approach with electricity access at the national or regional level, clean cooking, energy efficiency, and sustainable cooling. It helps you to directly access good practices from across the globe, as well as guidelines, templates for standards, and so on related to that particular subject that you're interested in, and have this all combined at one platform. But enough about theory. I would invite you all, in case you have a mobile phone, to scan the QR code that is shown now at the presentation, or type policyhub.seforall.org into your browser. So you can have a closer look at what this actually looks like. I'll also briefly take you through the platform on my own browser. I hope you can see it well. So as said, the Policy Hub does not only include powering healthcare, but also covers the area of electricity access, clean cooking, sustainable cooling, and energy efficiency. We're gonna take a look at the powering healthcare subject. So let's assume that healthcare is already included in a national electrification plan or strategy of the country that we're investigating. And we'll end up with these options. And let's assume I'm most interested in looking into policy and regulatory aspects of technical dimensioning of powering healthcare infrastructure. And here, some technology considerations that are of interest for me is the energy efficiency on demand side management. And the Policy Hub provides us with some useful resources from across the globe. Here, there's a case study on supporting energy efficient use for better rural health outcomes. If I'm interested in this resource, just click on this link and I will end up with this particular resource on another platform. And if I just want to sneak peek into what is included in the resources listed here, there's just an excerpt, a very brief text summarizing how this resource informs that particular area of healthcare electrification that I'm interested in. In our case now, energy efficiency on demand side management. The Policy Hub also includes a digital library, a digital repository of resources. So depending on what type of information I'm interested in, I can, or particular countries that I'm interested in, I can filter the resources and land with the respective information. So in summary, this powering healthcare component of the Policy Hub can help you to gain direct access to resources informing policy and decision-making process to powering healthcare, and combines vast knowledge from across the globe and targeting them exactly to your interests and needs, which we hope can support your work in order to contribute to universal access to electricity and energy for health facilities all over the world. So if you're interested in learning more about the Policy Hub, or you have specific feedback about the Sustainable Policy Hub, or you even have some good practices or reports that you would suggest would match the purpose of this online tool, and you would like to share them, please feel free to reach out to myself or a colleague Raul. Emails are included here. I understand the presentations will be shared, and we look forward to hearing from you. Thank you all, and enjoy the rest of the conference.
Thank you, Nicholas. I think we can go ahead and start with our panel discussion. If we don't have any questions, so I don't see questions per se via the chat. So I'll let Rahul take the panel discussions, and if you have any questions, we can address them during the panel discussion. Rahul. Hello, Rahul, can you hear us?
Sorry, Daniela, there's a couple of questions in the Q&A chat box.
Yes. Somebody, okay, I can see them. Somebody's asking how feasible it is in LMIC when they are struggling to provide basic PHC care to communities. It needs a concerted effort from all stakeholders in countries. We're seeing increasing effort from donors on CapEx, but operational maintenance is neglected and the systems are breaking down in a few years and not operational. I'm not sure. Maybe we would address that during the second part of the conference today. Somebody's also asking, is also interested in hearing more practical and successful examples on sustainability. Again, something that will be addressed during the panel discussion. But then if Nicholas and Dr. Frederick have inputs, please feel free to share now before we go into the panel discussion.
Yeah, thank you, Daniela. I mean, myself, I'm probably not the best person placed to point you towards these good practices or good examples directly. But again, the Sustainable Energy Policy Hub has collected several good practices, including from countries in Africa, related to healthcare electrification, when it comes to policy, when it comes to regulatory aspects or technical considerations. So please feel free to use the link that has also been provided in the chat, and maybe through the digital repository, you will be able to find some good inputs.
Thank you, Nicholas. Rahul.
Sorry, just
Daniela? Hello?
Yes.
Yeah, I think, we may want to take a bit of a break, right? Because the panel starts at 8 my time. That's what the speakers are being told.
All right. So we'll go on a break for 15 minutes, about 15 minutes, and
Yes,
then
yes, please. Yes,
we'll
please.
reconvene at
Yes.
8 a.m. your time.
Yes. Yes,
All right.
please.
Thank you very much. See you in 15 minutes. We'll be on a short break. Rahul, whenever you're ready, I'll share the answers later on in the conference.
Yeah, just give us a minute, Daniela, for Gina to maybe join, and if she doesn't, then we'll get started. All right. So Gina should be in a minute. While she joins, I just wanted to make a quick announcement that I missed making when I opened the conference on behalf of SE for All. So SE for All, HEPA, which is the Health Energy Platform for Action that's hosted by WHO, Salvatore is on this call, and also on behalf of HETA, which is hosted by Power Africa, which will be represented by Gina. We are organizing a 2-day conference in Nairobi on the topic of powering healthcare. So this is going to be a really important conference, pivotal conference, attracting around 150 to 200 people. I repeat the dates, February 3rd and 4th in Nairobi. If you're interested to join, you are requested to write to the email address that I'll be typing in the chat box. So please write here and give us a bit of a sense of why you would want to be a part of this conference, and then we'll accept. We'll review your email and get back to you. So just wanted to make that quick announcement. Great, we have all our panelists here. So hi Gina, hi Salvatore, hi Ranjit. Good morning, good afternoon, good evening. I guess it is truly morning, afternoon, evening. We have US, Geneva, and India here. So a very well represented panel globally. We really wanted this session to set the stage for where we are today in the powering healthcare space. And as I mentioned earlier during my opening remarks, COVID-19 really put a spotlight on this topic and helped the sector garner a lot of momentum. A lot of good developments have happened since then, but we still have a big gap, right? I mean, as I mentioned, close to $5 billion is needed to electrify health facilities in the global south. That's a huge number. A lot of work needed from various stakeholders. I know HEPA and HETA are super active with their coalitions, with the funding that they're mobilizing, with the partnerships that they're forging to essentially help address this gap. So a lot to be done, and I really wanted to kickstart with Salvatore. As I mentioned, Salvatore is from WHO, and WHO hosts HEPA, which is the Health and Energy Platform for Action. Salvatore, as a part of WHO and HEPA, what do you think are some of the key global trends that you're witnessing in this sector, especially since COVID? Can you give us a bit of a flavor of what some of these key global trends are and what we should be expecting?
Thanks, Raul. And first of all, good afternoon, good morning to all participants and to my friend Gina and Rajit, and to you as well. Of course, thanks for the invitation. Well, as you mentioned, COVID somehow was the point where many people realized how important was electricity, for example, for oxygen, right, and for other elements. So the reality is, I'm sure that you have already mentioned this element, but still we have 1 billion people worldwide served by healthcare facility that don't have any electricity or that have unreliable electricity. This is obviously a huge problem. In addition to this, we have also seen that even when there is electricity, as many colleagues that are online, I'm sure they witnessed, even when there is electricity, often this depends on diesel fuel generator. What we have seen that in many cases, we are seeing in many countries that not only diesel is very expensive, but it's also often not available. And this is one of the issues. Now, in terms of the trend, the opportunity that we have is certainly the decreasing cost of renewables, and especially the decreasing cost of solar, right? The cost of solar system has gone down dramatically last year for 30%. So we really have the opportunity now with decentralized solar system to accelerate electrification of healthcare facility. When you tell me about the trend, one of the trends that we are seeing at global level, for example, is an increased cooperation between energy and health sectors. And this conference is an example, right? In this call, we have institutions working on health and institutions working on energy. At global level, this is more and more happening. I'm sure in the conference that you mentioned, we will have certain examples. At country level, though, this is still an issue. In many cases, we still have a lack of coordination between energy and health sector. And another fundamental aspect is the coordination with the finance. You mentioned the 5 billion number. If you put in perspective the benefit that we would have with the electrifying healthcare facility is huge compared to investment. We are talking about saving millions lives of people compared with an investment that is really lower compared to many other investments. So I would say at the global level, we have a positive trend, cost of renewables, increasing awareness, increased cooperation, but still we have big issues. I'm sure during this session, we're going to talk about some of the challenges that we still have. One is the finance, the access to finance, and there are many others that I'm sure we will have the chance to talk about.
Thanks, Salvatore. Great points. And I think one point that I would emphasize is the climate point that you mentioned, because, many times I feel all the work that we do, really contributes to positive climate action, and we don't take enough credit as a sector. Everything that we do in terms of solarization and the other initiatives in healthcare electrification is very much keeping climate as a key focus point. And very often we don't talk much about it. But certainly displacement of diesel generators, of course, there's the climate mitigation part, but even climate resilience, in terms of how we build health infrastructure in a more climate responsible manner to adapt to the climate risks that we are seeing across the world is also something that should be discussed more. So, and ultimately, it's really the climate, health, and energy nexus that we're looking at. So thank you for bringing out that climate angle, which I believe is often overlooked or not emphasized enough in our work. Thank you. I'll move on to Gina. So Gina, HETA, which is the Health Electrification Telecommunication Alliance, it's hosted by Power Africa. You lead this initiative. You've brought together various partners, across the spectrum. I think full credit to you and the Power Africa team for bringing together partners from across this spectrum, whether it's multilateral agencies or private sector actors. I think it's phenomenal, the targets that you've also looked at, along with SE for All. Your team helped put together the Energy Compact, where we brought in various partners to signal their intent and ambitions to electrify health facilities. Can you tell us a bit more about some of the key initiatives that HETA is targeting? Maybe one or two key initiatives that HETA is looking at on a global level, as well as, say, on a country level, to accelerate electrification of health facilities.
Sure. Thanks, Rahul. And yes, thank you. Great to be part of this panel with my friends and colleagues here. So HETA, that's hosted by Power Africa, which it sits within USAID, but it is across 12 US government agencies as well. So we have that sort of power of convening the agencies, the other government agencies as well. And so in that light, one of sort of the more global or regional initiatives that we're trying to do right now, then we're really focused on, is to convene the powers of the health donor community so that we are all moving in the same direction, right? So that we're not competing against each other with these models, given that, as Salvador mentioned, access to financing is so difficult to sort of overcome, and each market, each country's market is different. And so what we're trying to do as the US government, we do have that convening power, and we also have a large investment in the health sector in the global south, especially in sub-Saharan Africa. And so right now, that's really one of our priorities, is to look at the various types of investments that not only the US government is doing, but also in which the US government supports, such as Global Fund, Gavi, et cetera, to understand how we can all be working towards one or a set of models that are complementary to each other rather than sort of conflicting with each other. So we're really trying to change that marketplace which is a glacial movement, right? Like that's not going to change tomorrow. But having those conversations and understanding what restrictions and how each organization's money is obligated is really important, so that we can sort of shift the conversation into a more sustainable model. Because going into sort of more what Power Africa is about is what we're really looking at is like, where is that long lasting sustainability of operations and maintenance, and then the productive uses that come out of electrifying Africa. And so we can't have that if the majority of the systems are donated without O&M taken into account. And so we are really trying to shift that, as I'm saying. But again, it's a slow moving glacial movement. But I do think that we have that sort of momentum behind us. And then in certain countries, I'll name maybe two, what we're trying to do is looking at where are those models that do demonstrate opportunities for this sector. So for example, in Tanzania, we're working with several several energy service companies, along with data management health organizations, in which they're packaging and bundling services to provide to private health facilities, in which that helps create more efficiencies at their facilities. For example, at pharmacies, where they can digitize the inventory and then pool and aggregate that inventory across that network of users that are using that data management system. And so in order to do that, they can save money, and they can and then they have the digital and electrification access to at their facilities. And what they're seeing is they're able to not only track their patients better and sort of offer a more efficient array of necessary medicines, but what my health colleagues at USAID are seeing is that we really are being able to get patients in at the first line of care, rather than them allowing, like, waiting and going to something that's more serious, waiting till it's more serious. So that in the health side of the outcome has been really successful. And then in Sierra Leone, our opportunities are with, again, private health facilities and some public health facilities, in which we're looking at productive use through the oversizing of facilities. And we co-locate a sort of business, if you will, entrepreneurship, and to see if we can share that electricity and digital connection at the health facility and the entrepreneur business that is co-located. And then the operations and maintenance is maintained by the business that is there, rather than having the healthcare workers sort of look to be sustaining that and maintaining that system. And what we're seeing is actually the revenue generation for both the business that's co-located and the health facility in Sierra Leone are increasing on a monthly basis. And so that revenue generation is allowing for payment of services of the electricity, and also putting together an operations and maintenance fund, so that in the future it can be drawn upon, which again allows for that sustainability. So those are just a few examples across the continent that we're working on.
Thank you very much, Gina. And I think great that you address this big elephant in the room, which is sustainable models and sustainable operations and maintenance. And fantastic to see how HETA is looking at different avenues to make sure that this O&M can be paid. I think it's a big elephant in the room. I think Karan from Gavi also mentioned this in one of his comments. Certainly a huge problem, but I think the other encouraging part I would say is that, as you mentioned, this is a glacial movement. It takes time. Increasingly, we're seeing various partners, including governments, recognize this issue and at least trying to brainstorm some solutions moving forward. A few years back, this was not so much of a discussed topic. many a times, when we went and spoke to government counterparts, this topic didn't necessarily receive a lot of traction. But I think that's changing, and I think that's in part to it's due to efforts from various organizations. Of course, there's WHO, there's HETA, there's the World Bank, there's SE for All. And we have UNICEF. Maybe this is a good segue to head to Ranjit. I mean, UNICEF, as many of us know, was really a key partner during the COVID-19 crisis in terms of making sure that you had sustainable cold chains for vaccines. I myself, at that time working at the World Bank, really benefited from what UNICEF did. I think it was fantastic to work with UNICEF, to see the kind of work they did along with Gavi and WHO at that point. And now UNICEF, WHO, Gavi are looking to further work on electrification of health facilities, using all their experience in the cold chain arena to actually work on solarization of health facilities. So I think, which is a very welcome development. So over to you, Ranjit, to tell us a bit more about the shift and what are some of your key initiatives moving forward in the healthcare electrification space.
Thanks, Rahul, and thanks for inviting to this great panel discussion. I come from immunization supply chain team in UNICEF headquarters. I lead the primary healthcare infrastructure portfolio, and we work very closely, as you just mentioned, with Gavi and WHO, also with Gina and Power Africa, HETA team, on cracking some of the O&M issues. But to take you to the background of, you just pointed out UNICEF actions in COVAX, and also a lot of cold chain was built in, added to the existing infrastructure. Prior to COVAX, there was a beautiful project started by Gavi called CCOP, Cold Chain Equipment Optimization Platform. This project was to enable the cold chain systems in the country to support the rollout of a vaccination program. And one of the elements right from the beginning was also to look at the pandemics and the structure in place to support the pandemics. So with this program, UNICEF being the implementing agency of the CCOP, funded by Gavi, and about 57 countries and odd benefited from the CCOP platform. About 100,000 fridges were rolled out into remotest part of the countries, and we took it from there. And of course, during COVID-19, with COVAX support, many fridges were added to the infrastructure. And we took that as a foundation and said, look, with the immunization program, we are reaching out to this remotest part of the world. Can we test this theory further? Can we expand ourselves? Is it possible to use the same efficiencies with which we deliver the CCOP program and achieve higher results? So with that, a learning agenda came up, and together with alliance members, WHO, and with Gavi Secretariat, UNICEF, we sat together and we designed what is called Learning Agenda Project, where we initiated solarization of health facilities in 4 countries, and about testing the CCOP processes to say that if we deliver not only just a fridge, but expand our scope to solarization of entire facility, including wash component, availability of water at the facility, which is critical, including connectivity part as well for digital health initiative. We looked at, so impact point of view, we wanted to see whether you can improve the maternal services, child health services, neonatal care services, laboratory services, OPD, extension of primary healthcare to other commodities, not just fridge availability for the vaccine, but also for oxytocin and anti-snake venom and other drugs that requires refrigeration. So all in all, that project inception came, and then we are in the middle of implementing that and testing the hypothesis that should we be coming from immunization community, be the leaders in taking the solarization of health facility as part of CCOP project in future. And then within UNICEF itself, we have a strong commitment to climate resilience. So with that agenda as well, and primary healthcare as a whole, we're taking this opportunity to also establish long-term agreements within supply division of UNICEF to support countries benefit from those long-term agreements that provides the turnkey solution of implementation of the project, not government, but also transportation, deployment, capacity building, and handholding of government with O&M support. So with that, this initiative is going on in about 10 countries now as we speak, and we are partnering together with WHO as well on this initiative, taking it forward. And as you rightly pointed out, and everyone is looking at elephant in the room, is O&M, operation and maintenance. This is something they're putting very high emphasis on how do we actually sustain this system. Providing this system is one challenge, then how do we sustain it? And another big challenge we're looking at in this is really how do we make the best use of energy being available at the health centers. So energy is an enabler of services, right? So what else is needed in addition to energy to make sure that the services are provided? So those are some of the key initiatives we are looking at now as we speak, Rahul.
Thank you, Ranjit. And as I mentioned, I think it's a very welcome development to have UNICEF, Gavi, WHO work on solarization of health facilities. You have a lot of experience on the cold chains front, as you mentioned, CCEOP and a few other programs, and hopefully that experience can be used constructively to further O&M, in health facilities. For the second round of questions, I'm going to start with you, Ranjit. And you mentioned how your initiatives are now active in 10 countries, and more so in the 4 countries that you've begun with. Given that UNICEF has made this shift and now included healthcare electrification, in its work plan, tell us a bit about the challenges you have faced, moving forward. What are you seeing that you think really needs to be addressed? For a fact, we all know that governments often will tell us that they don't have much fiscal space. It's very difficult for them to pay for O&M. It's very difficult for them to pay for certain things that are important to secure sustainability. How do you usually tackle those discussions, and how is UNICEF planning to navigate this complex landscape? So if you can tell us a bit more about what challenges you're facing after you've made this shift, that would really make this discussion much richer. Over to you.
Right. So there, Salvatore also pointed out, I think one of the initial challenges is really financing, looking at budget for sustainability point of view, and second is really it's stemming from, let's say, ownership aspect, that if how do we let's say the model we are all following is capex model, right? Bringing in donation, bringing in funding from out external sources and chipping it in, whereas operation and maintenance has to sustain over a period of time. So O&M is one big challenge, and getting the funding for O&M, even the selecting the right model for O&M. Should we be doing in-house? Do we have capacities of doing house? Many countries we have seen that they have this aspiring vision of continuing maintaining the system in-house, but then in parallel world we see that this is not well demonstrated, that the maintenance of other systems were not so up to the mark. So selecting the right model of maintenance along with funding support is one big challenge. And second big challenge we see, I mean, we could bring energy as an enabler, but then it will take time to again build the capacity of the health center itself to be able to fully equip and provide all the services they're supposed to. So having the essential medical devices in place, having the capacity building, training of health workers to use those devices as they go, availability of health workers themselves. So bringing energy will not be a game changer on day one. It will be a long shot till we bring all the elements together as we speak. So selection of the health facilities also is another I mean channel, that when we do the intervention, we want to make sure that this is high impact health facility where other services are already running. Probably they're using diesel generators, and we replace the generator with clean energy, so that the impact is there already. At also at the same time, we don't want to overlook the equity angle, those health facilities which are not operational because of energy, so we want to operationalize them as well. So it's a combination of various things, but then building these systems together with government is something we want to see from here.
Thanks, Ranjit. I think you raise a very important point, which really talks about coordination between the different arms of the government and different sectors, right? So you're looking here at health and energy. I mean, we've all been in situations where we've sometimes entered a health facility which has all the health equipment but does not have electricity, and vice versa. I've also been to a health facility where the solar panels had arrived, but there was nothing inside the health facility. And that's not good. I think that essentially is telling us that the health and energy arms, of the implementing agencies or the financing agencies are not necessarily talking to each other, and this really tells us that you need coordination committees, not only within the government, but I would say even our own organizations, right? When you talk about some of the big organizations, it's important that the health and energy teams in those organizations or with counterparts in other organizations are speaking to each other. And the same thing with donors. I think it's also important for donors in the health and energy spaces to talk to each other, so that there's an optimal effort to make sure that energy is providing the requisite services. As you correctly mentioned, Ranjit, energy is essentially a means to an end. If you just have energy, it doesn't do anything. It needs to provide the service for which it's essentially being applied, whether it's health, whether it's education, whether it's agriculture. So a very keen point here on coordination, which should look like a very obvious point or a low-hanging fruit, but is a big challenge. We see this over and over again, and through at least our work, SC for All always maintains or always incentivizes our partners to work in tandem, both from the health and energy sector. So thank you for raising that very important challenge, which we must constantly remind ourselves is still a big issue. It has nothing to do with technology. It has nothing to do with financing. It has to do with discipline. It has to do with putting your heads together and wanting to work together, which I think was very well done during the COVID pandemic, where I really felt the health and energy sectors came together to solve a big pressing challenge. No, thanks, Ranjit. Moving on to you, Gina. Wanted to get a better sense from you on what are some of the key issues you are seeing, from a HETA perspective, and maybe if you could, even focus more on what you're hearing from the private sector. Given that HETA works so closely with the private sector, along with all the other partners you mentioned, but I think one of HETA's key strengths is that you're so actively involved in discussions with the private sector at the grassroots. So curious to hear what you're hearing from them in terms of some challenges.
Yeah, thanks, Rahul. So just to give some context, HETA is a public-private partnership led by Power Africa, so seed funded by Power Africa, and then and USAID Global Health Programs. And then we use that seed funding to then match with private sector dollars to electrify and digitally connect health facilities. So in that manner, we have more than 50 private sector partners that we work with in some sort of capacity, whether it's through data sharing and equipment in kind, like resource leverage, or just straight up, pooling our funds together and things like that. So, and we work across both foundations and NGOs, but also in the private sector as well. So from what we are hearing in the private sector, one is that I will start off on positive, is that they all want to do this work. They all see the value of this work, and they understand the opportunity that electrifying a health facility in any type of community, whether it's urban, peri-urban, or rural, could really bring to the community, to expanding electricity and economic growth and better health outcomes in that community beyond just electrifying that health facility. So they all want to do this. This is not something that's asking a lot of them. What is asking a lot of them, and what is the challenge that we all keep talking about, is that financing. Because the health sector is quite a difficult sector to be working in when the general model is a donation-based model that, hey, my government also does a lot of, where we donate a lot of equipment and things. And so it's really hard to compete with free, like a free program that's donating medicines and services and paying healthcare workers. And then we're asking them, even at a subsidized rate, to pay for electricity and digital connection. So it's hard to compete for free. And then if they are not paying, eventually, if they don't pay, it's very difficult and not a good look for any energy service company to then be taking those panels off a health facility that's saving lives. So there is a risk within this model that we're looking at. And across the various models, whether it's an energy as a service, a lease to own, a buying outright, a pay-go, the ultimate collateral that the energy service providers have for every other sector that they're working in is their equipment. But they can't really take that equipment away at a health facility. I mean, they could, but it would look very bad. So that is one of the biggest challenges, which is why through our program, we're really looking at, like, what are those other productive uses that can be expanded if the anchor is the health facility, and then we can expand it to bringing in other opportunities in and around that community health facility, so that should there be non-payment or payment in arrears from a health facility, it can still be a productive installation, because we're seeing the kiosk, the tailor, the welder, and others buying power from this installation as well. And so that's really where we're looking at, like, where are those opportunities for us not to just power the health facility, but to be powering, providing the opportunity for others to buy power as a service, energy as a service, so that it helps stabilize and maintain that investment from the energy service company.
Thanks, Gina. Definitely, I think the payment risk is a huge issue, and you're spot on. When we speak to the private sector, we see that they have such bright ideas. They're 2 steps ahead of the game. Much ahead of the game compared to many of the other organizations that work in the space. They have the ambition, they have the technology, and in many cases are willing to also raise financing, but they want some guarantee that they'll be paid. And especially this becomes difficult when the off-taker is a public health facility, right? Because you can't just disconnect a public health facility if you're not paid. That's why the health facility is a very different type of client, if I may say so. It's different from a household. It's different from some of the other clients that a private sector company would work with. Given the huge public benefit that they're providing. So it's very difficult to just remove the plug if you're not paid, and that's what makes it a more difficult proposition. Payment, and it's great to hear about some of the measures that you're looking at to avert this payment risk. Whether it's cross subsidization in the community, or as you mentioned, making sure that there are different avenues to have revenue to pay for O&M. So I think those are well noted, and I think with time, as some of your initiatives gather more steam, and you'll have more learnings on what has worked and what has not worked, and hopefully those practices can be applied not only to HETA projects but also other projects that are spearheaded by the wider community. So thank you for raising that important issue of payment risk and how we can look at averting it. And I think it's also important to realize that every country or community would be different. There's no one silver bullet solution. There can't be one, right? Because countries are different, their fiscal spaces are different, the way they work with their health systems is different. So I think we need to acknowledge that and then work within the context of that country or community to see how you can avert this payment risk, or at least mitigate it to the extent possible. Great. Salvatore, moving on to you, curious from whatever you've heard and from where WHO stands, what are some of the key challenges you are seeing from a WHO and HEPA perspective, and how do you think WHO and the wider community should be looking at addressing those challenges?
Well, Raul, you were part of the report that we published a couple of years ago, right? It was energizing health, where we really tried together to put together different challenges and different approaches, because as you said, there is no one size for all. Certainly, the point that Gina was mentioning, I think it's key. We have to keep in mind when we talk about electrification of healthcare facility that we are talking about a human right, health as a human right, which means it's completely different than any other economic activities, right? So when we enter into electrification of healthcare facilities, the crucial aspect of who pay for it is essential, right? We cannot really expect the rural healthcare facility in Burkina Faso or rural Somalia to have the budget to pay for it, because we know the situation, right? So at that point, these again put in the game the key role of public institutions. And when I say public, I also mean supporting development partners, so government, but also donors, also governmental, intergovernmental organizations, financing institutions. We need to understand that when we talk about electricity for healthcare facility, we are talking about the need to protect the health of the most vulnerable population. So we need to find the best way to do it, right? So from that point of view, that need for finance is crucial, and is essential that all the different actors step up somehow. I often hear this big press release on multi-billion committed, billions committed on renewable energy, billions committed on climate. I don't know if these commitments are true or not. The reality is that in perspective, it shouldn't be complicated to find 5 billion to electrify all healthcare facility, but unfortunately we are not there yet. If I hear commitment to develop renewable energy, what can be better than renewable energy in healthcare facility, where in addition to have climate mitigation and adaptation, you also save life? And this is one point where I think we really need a bigger commitment from everyone. The second point is related to the point that also Regit mentioned on the importance of coordination with medical devices, right? Our impact, if we provide the kilowatt hour, but there is no oxygen concentrator or incubator or spotlight, our impact is zero. We have not done nothing. So it's crucial to stay in touch with institutions that can provide or can support medical devices, if it's not possible to include in the program itself, right? We all want that. And from this point of view, the initiative that Regit mentioned with UNICEF, Gavi, and WHO is a step forward in a holistic approach, in a coordinated approach. So we took one platform that was focusing only on the cold chain, and we expanded to include energy also for the other services. And in principle, this is an approach that should be followed also by other actors. We often have also in the health sector, we often have a silos approach, institutions or program focusing on oxygen or on water or on the labor room or on lighting. And we have been working, all of us in this sector for a while, we have all seen healthcare facilities that have 3 or 4 or 5 solar systems on the roof for different devices, right? And this is not only is not efficient, but obviously if you have so many devices, it's also difficult to have an operation and maintenance contract that cover the long term, right? If you have a 500 watt system. So it's important that all actors really work together in a holistic approach. And we identify what are the facility, we electrify the facility to cover all the needs of the facility. And this will bring me to the other, as you said, elephant in the room, that is the operation and maintenance. So we go back to this issue over and over. And unfortunately, we are not there yet. We have seen every time we go to a country, we see many facilities where there are systems, solar systems that don't work anymore. The cost of operation and maintenance is 3 to 5% per year, but that cost, that budget need to be accounted for. And we are not there yet. And this means that if we don't have that element, it's really impossible to have long-term systems, long-term functionality of the system. So this is what we call the install and forget, right? When often the institution focus on the initial part, we think that then someone else will take care of it, or the government will take care of it, or some other organization. Often this doesn't happen, and we cannot continue to close our eyes and thinking someone else will take care, because it's not happening. And we are all seeing already that many institutions are asking for support to bring solar system in facility where there is already a solar system, but just doesn't work anymore. So these are the key issues that I think as a community we really need to address. I mean, we are really in a moment where we have a huge opportunity. Solar is, as you said, is not a technology issue. It's not a cost issue, I would say, if you compare with the diesel option, or if you compare with the cost of not doing it. What is the cost of not? When we talk about return of investment, in our case, we are talking about million life. WHO estimated that just electrifying and providing medical devices to 30,000 primary healthcare facilities will save the life of about 8 million people from here until 2050. So we are talking about an investment that clearly makes sense under our point of view. So I think the solutions are there. We need to put in place. If you allow me one more comment on the crucial role also of donors and development partners on this. Often we are in a situation where donors say, I provide the funding, but the funding has to be disbursed in 2 years. And this doesn't help. This doesn't help because of what we said about the operation and maintenance. So we need to find a system that allow us to support long term, or also donor and financing institution need to be more flexible, or we need to identify other solutions that go in the direction, in addition to what, of course, Gina mentioned, that can apply to certain situations, while in other situations we may still need the more classical long-term operation and maintenance. So let's say we are in a critical moment. I really commend you and thank you for keep having this discussion. I think the conference that with the C4All and with the HETA we will organize will be a critical moment to really identify solutions and really make sure that electricity is in every healthcare facility. Thanks.
Thank you very much, Salvatore. And I think it's a good segue to the last question I want to pose to the three of you. And I'm mindful of time, so would appreciate a brief response. When you talk about solutions, I'm curious if you have thoughts on what policies or regulations, say from the government, or anything else that you think comes within the ambit would be useful to move the needle further to electrify health facilities. So policy regulation, from the government side, or something else that you see in this space that you think would be helpful. I'll start with you, Gina. Over to you.
Thanks, Rahul. I think I'm quite excited about this one. So I think there are some really straightforward policy reforms that we can all be promoting, and Power Africa is sort of taking that on, but we would love to be joined by others. And that is, first and foremost, part of the reason that electrification, solar electrification, is not always as cost competitive as a diesel genset is because of the tariffs of each country for importing those goods into that country. And so if we can work with the various 40-some countries across Africa and others in the global south to help lower that tariff of import, then that the solution that we all know is the solution that creates that resiliency, that creates those opportunities for expansion of growth can be more realized because the upfront cost will be lower, right? And so for us, that's one thing that we're really looking at, and that we would really appreciate just a global community to really be pushing that across, especially if it's being used in a humanitarian sort of way. If we could create exceptions and things like that within the government systems, that would really help advance our movement and the solutions forward in this space. Over.
Thanks, Gina. In the interest of time, I'll quickly move on to Ranjit.
Thanks, Rahul. I would say, I mean, so the first recognition, as your question is loaded in a way that government is planning for electrification of the health facilities, and when they're planning for electrification, they should look at beyond capex model. They should look at really energy as a service model and make provision for regular payment of energy. I think that will take off a lot of load on the O&M part and the upfront capex. And then also it will also build a good. We have seen there is a good market, private sector interest in doing so. So the policy also need to ensure guaranteed payment to the for such a service. If you compare, I agree with Gina. I mean, the cost of solar sometimes seems higher because of tariffs and etc. But if you compare head to head over a 10-year period of using diesel generator, and diesel generators are used today. I mean, somebody is paying for diesel. So if we can use that as a replacement cost for solarization, I think it's just a shift of mindset that can bring in energy in a more efficient manner and climate resilient manner.
Thanks, Ranjit. Salvatore, over to you, and then I'll try to summarize this discussion.
I think Gina and Rajit mentioned really the key point. And for example, we have seen, we know that the government in many cases have a budget line allocation for diesel, for example, but sometimes we struggle to add a budget line allocation for the operation and maintenance of the solar system. It's just a budget line in the national line. Sometimes it's not, it's even lower than the cost for the diesel, but it's still difficult sometimes to add that component. And often at country level, there is this, let's say, lack of coordination sometimes between the Ministry of Energy and Ministry of Health, with the Ministry of Health thinking that electrification is an energy issue, and therefore, and vice versa. While more and more we think electrification need to be integrated as a key element of every healthcare facility. The point of climate resilience that you mentioned is crucial, right? Having decentralized solar system when possible, obviously, especially a primary healthcare facility, for example, is crucial to increase the climate resilience. So this kind of element, but also the key role of the government in building local capacities, right? When we talk about operation and maintenance, in any case, even if you do it through a local company or to do it through a local institutions or a local technical cell within the ministry, it's crucial the role of local capacities, right? And this is also our role as a supporting institution to make sure that we benefit from local capacity and we support local capacities. And the other one is availability of data. Sometimes we still have issues in understanding on what is the status of electricity in different healthcare facilities. So pushing for that kind of data gathering and analysis would help many organizations. In many cases, having a clear knowledge on there is electricity, there is no electricity, is unreliable, there is a LoRa system, there is a diesel generator, but it's not working. This kind of information at facility level would help also other development partners that are willing to help, right? So having this kind of support, including, for example, the data gathering on energy access at healthcare facility in the normal standard health surveys that we do, that the government do at facility level, would allow to get data that would be very important also for further actions. So I would say these are some of the key elements that would help.
No, thank you, and I think I'm reminded of one of my conversations in my previous role when we were working with one of the government agencies. We were told that solar should be free. Why should we be expected to pay for solar, right? The whole idea of replacing diesel with solar is that solar is free, and we had to remind our counterparts that sunlight is free, but solar is probably not free. You need to make sure that there is operations and maintenance. And as you rightly said, Salvatore, many a times there are separate lines for budgets for diesel, for procuring diesel, which is often subsidized. That's the other part, right? So on one part, your tariffs for solar are not reduced and your diesel is subsidized. So that further, kind of flips the whole economics issue, right? And I think the point here is, as you said, we want to make sure that if there's a budget line for diesel and we are replacing it with solar, then there should be a budget line for operations and maintenance too. So I think that is really something we need to advocate for and include in our narrative when we speak to various governments and donors. I think that's definitely a very valid point. And I think the other key issue when you're comparing costs is the climate cost, which is often not accounted for. When you're comparing diesel with solar, we obviously discussed about how tariffs can be reduced, the subsidies that are often in benefit of diesel, but also the climate costs of using diesel and polluting fuels. I think there's a huge climate cost which is not usually accounted for in these comparisons. And if that is also accounted for, then solar is definitely more it will be the winner. And Salvatore, the other key point you mentioned about the cost of not doing anything, the cost of inaction, I think that's huge too. Many times we've seen cases where we are told that the grid will arrive at some point and we just wait for that. And again, in my previous role, we've seen cases where you have a health facility that has waited for the grid for 5 years. That's just unacceptable. That's just unacceptable that you wait for the grid for 5 years and don't provide the health facility with a transitional arrangement, right? I mean, we're not saying that off-grid solar or last-mile solar electrification is a solution that will last for life. I mean, if the grid arrives there, sure, I mean, it can kind of take over. But by the time that you don't have that 5 years and just waiting for the grid, that's cost of inaction, a huge cost of inaction where lives are being lost. Human capital development is hugely compromised. So certainly, I think these are key factors to be considered when you're looking at the whole economics of electrifying some of these last mile health centers. I think we've come to the close of this discussion, but I do see some very interesting questions here, particularly on the energy as a service model. I'm going to take one of these. Again, just in the interest of time, can't go through all of them, but I'm going to just take one of these because I think it's a good question. And I would request our panelists to give it some thought and response. So here's the question. Energy as a service is really only viable where the government can pay. If the country is in the 10 poorest countries in the world and then they don't have cash or fiscal capacity, what can they do? You're left with the hope that they'll pay something, hopefully 10%, but actually they might pay nothing. So how do you kind of address this huge conundrum, when energy as a service may not be ready in certain countries, say, 10 poor countries, as mentioned by this anonymous attendee. So over to you, your thoughts on how you deal with this sort of issue with the really poor countries that really don't have much fiscal space. Any of you can volunteer to take this on. It's not an easy question, but I think it's a very good question.
I'm happy to take a stab at it first. We definitely see this across our country landscape that HETA is working in and that USAID works in. And I would say first and foremost that most health services also aren't free. You get the basic services in any country, but every patient has to pay something, right? From what I understand about the health sector, I'm not a health expert, but I dabble in the space. And from what I understand, basic services are covered, but anything more you have to bring or you have to pay for. And so that facility is collecting some funding. And so what we see in our sort of more poor landscapes and markets that we're working in is that if you're able to expand the services at those health facilities, they are able to charge and people are willing to pay for it. So in most poor countries, we see that it's almost a half 50-50 split of going to a public facility or a private facility because it's based on the services that that patient needs. And so if we're able to expand the services at the facilities, they are willing to pay something, maybe not all of it. And if it gets subsidized through the donor community, which it's already being done, then it creates a pathway at least, right? And like we keep mentioning, this is not an immediate switch that's going to be turned from a donation-based model to a payment for services model. It's going to be a pathway that we are leading them on. And so if we can get them at least starting on that path of starting to pay for energy, we can then switch the conversation and perspective that Rahul brought of solar is not free. The sun's light and energy is free, but capturing that is not. And so that's what I would say is that we just could collect some through and then subsidize and then hopefully get towards something over a long-term time period.
Thanks, Gina. Salvatore, Ranjit, any reflections on that question?
Yeah. Mentioned before, there is not one solution that applies to every situation, right? And Gina she herself mentioned before, this is one of the options. Of course, when we talk about the very marginalized and poor community, the concept itself of universal health coverage means that all people have access to the full range of quality of services without financial hardship. So the point on who pay for it does of course, when you have very marginalized communities, it's clear that this cannot be on the burden on the patient, on the facility. In many facilities that we have seen, even the people working there don't have a salary. And this is the reality. We can talk about many other aspects. So in those points, the comment of the colleague that put this comment on the chat is true. Who pay for it? How you can give the private company the guarantee that there will be someone that pay for it. So in that case, maybe other international organization, World Bank or financial institution can join to have a guarantee for non-payment from the government, right? Or a donors or someone else can say, okay, if the government doesn't pay, I'll pay. But still, this doesn't mean maybe this is not the right approach. Maybe a different approach is better in different context. A classical operation, a classical system that is owned by the facility, not through an energy for service, but by a normal process where you have operation and maintenance. But still, if there is a company that will serve for operation and maintenance, someone needs to pay that company. It can be the government, it can be someone else, but certainly cannot be the poor mother, the poor family in the rural areas that don't have so the concept of hey, keeping in mind that we are talking about a human right, it's crucial here. There are different approaches. In some cases, energy for service can be the most suitable. In other cases, the more classical approach can be better. But certainly, we have to take the full responsibility to ensure that there is electricity in every health facility. So it's like any other. It's like a normal key infrastructure, right? Key infrastructure. When we talk about schools for kids, when we talk about a road, I mean, we need to provide the basics, right? Health is the basics. Having 1 billion people served by healthcare facility without electricity or without wash. I mean, just because we are talking about this big infrastructure, 850 million people are still served by healthcare facility without water. Not with non-reliable water, without water. So water, electricity, essential medical devices in every facilities. We need to make sure that that is provided. I mean, I think we have to make an effort in increasing also this awareness. I mean, maybe one of the points that we mentioned before is how can we really use the opportunity of the climate finance to work on it. Maybe we have not done enough. How can we really talk with the donors that are supporting renewables to tell them, okay, if you're supporting renewables, start from renewables in health sector, because that's, you can have the highest benefit. Maybe we need to make more effort in this direction.
Thanks, Salvatore. Thanks, Salvatore. You know, I'm mindful of time, so just want to quickly give Ranjit the last word here. If you have anything to add, Ranjit.
No, just very quickly. I mean, whoever is in driving seat to bring the energy at the health center, if it is government or if it is donors, they need to have the vision of 10 years, not just one shot exercise. I think that will help a lot to have to make sure that these systems survive for 10 years and deliver what they are meant for. Otherwise, it's a half-hearted action, and this is what we have seen. Technology has moved forward. The equipment today are a lot more sustainable than what they used to 10 years ago. So we have a good news there, but it's just the management part now, which needs to be taken care.
Thanks, Ranjit. I think that's a great way to end this. I think technology is not necessarily the biggest barrier here. And I would argue even financing is not the biggest barrier. There is money that can be spent. I know 5 billion sounds a lot, but I think money is also not the biggest barrier. The biggest barrier, I think the right word you used is management. And that goes to various thoughts that we brought up, right? Coordination between the ministries, between the health and energy sectors. It's a low-hanging fruit, doesn't sound very glamorous, but it's a huge issue. You need to have discipline and an absolute, in the right intention to coordinate and manage the process well. And then, of course, the government has a role. You know, we're talking about health facilities, which is healthcare is a public good. We need to make sure that there are favorable policies that make solar cost effective and essentially an optimal way to replace diesel and other sources of energy that are not climate friendly. So I think we can end this discussion with that thought that technology and finance, we've made a lot of inroads, and I don't think those are the biggest challenges, but really management, as Ranjit called it, is less glamorous, but really what is needed to make sure we can leverage technology and financing to accelerate electrification of health facilities. So with that, I'll close this discussion and hand it to my colleague Luke, who can wrap up today and tell us a bit more about what to expect over the next 2 days. Luke, over to you.
Thanks, Rahul, and thanks everyone for joining today. Thanks to our panelists as well. This is day one of a 3-day event. Today we really just wanted to set the scene, provide some general trends, challenges, opportunities. We already went a little bit deeper, which is good. We've been talking about this for a while. Like, we don't need to spend too much time talking about the why. We are talking a lot more about the how, and I think that's just a massive improvement that I've seen, especially from the pre-pandemic period to where we are today. The challenges are there. Like, there are so many. Like, I'm not gonna summarize all of them. Whether it's like data, financing, O&M, coordinating our efforts, management, I think it's a nice way to summarize some of these as well. In the next 2 days, we will delve deeper into some of these challenges, especially when we talk about O&M, sustainability, financing, as well as coordinating our efforts. How do we work better together to close the gap that still exists? We're well over time. I'll keep this very short. I'll just say we really do have a lot of momentum. Like, we've more momentum than I have ever seen in our sector, and I've been around for about a decade, working on this particular topic. I would say that, like, as we close 2024, I think we can be proud of where we are compared to a year ago, compared to 3, 4, 5 years ago. 2024 was a good year, I think, for powering healthcare. 2025 needs to be better, because as we've heard over and over again, like health, it's a human right. These clinics should not be in the dark one day longer than they absolutely have to be. These clinics needed power yesterday, right? So I think that should always drive us. I fully agree with what was said earlier as well. Like, this does, like, every day feels a bit like it's a critical moment. It's a critical moment. And I think every day that passes, every month that passes, I feel like we're heading in the right direction. We're still gaining more momentum, and a lot of that momentum is actually being turned into action. But there's always that risk. There's always that counterpart of like, what if something else happens? What if this drops off the radar? What if certain donors pull out and say, well, we're just not seeing the same sustainability. It's just not there. I really like that turn of phrase, like, what is the cost of inaction? I think maybe we need to be even stronger in voicing that, to make sure that we don't get drawn too far down a rabbit hole to make a rural clinic in Malawi more sustainable than one just outside of London, financially sustainable, right? I think we need to acknowledge what are the realities, what are we working towards, how can we put the available funding that's there to better use, how can we leverage it more, how can we bring in other types of funding and financing, how can we expand the role of service providers, of private sector actors, while still acknowledging the very important role that public sector actors will always continue to play, the very important role that donors and ground funding will continue to play in the sector. Much more to discuss. We'll see you back here tomorrow. Thanks again to all of you for joining us. When I joined, there was like 100 people on the call. Like, I'm really, it just gives me a lot of hope. It gives me a lot of joy to see that, as well as the starting discussion in the chat and in the Q&A. So more to come in the next 2 days. Please prepare your questions, and really hope that the next couple of days will be like more interactive as well. We really also want to learn more from you, hear more from you, and make sure that that all of us get at least something out of it at the end of Thursday. So with all that being said, thank you very much. See you back here tomorrow.